Good morning.
Good morning.
My name is Cody. I'm going to be your nurse today.
Okay.
Could you please verify your first name or your full name and your date of birth?
Marissa Brown, 11/28/94.
Excellent. I'm going to be doing a head-to-toe assessment today. Do you have any questions before we get started?
No.
So on first appearance, I'm noticing she walked in without difficulty. She had good posture. She was able to sit down on the bench without difficulty. I'm also noticing that her skin color is even. She doesn't have any uneven hair distribution. There's no visible lesions or patchy skin. Do you notice anything strange about your skin that you would like me to look at today?
No.
Excellent. Next I'm going to take a look at your head and your neck area. So I'm just going to start by palpating your scalp here. And I'm not noticing any lesions or dry skin. Taking a look at all areas of her face. Eyes are symmetrical, everything is in line, midline. I'm gonna palpate your sinuses on your forehead and on your cheek. Please let me know if there's any pain. Any pain there?
Nope.
Excellent. Any pain here?
Nope.
All right. Next I'm going to take a look at your eyes, which I need a pen light for. So right now I'm testing the corneal light reflex. Pupils are equal, round, reactive to light, and accommodate. I'm going to now test your gaze. So I just want you to follow my finger with both eyes. Okay, gaze in all cardinal directions is appropriate. I'm now going to take a look at your ears. She's got a couple of piercings, but the skin appears to be healthy and healed. Is there any pain when I palpate here?
No.
How about here on the tragus?
Nope.
Okay, we'll take a look at the other side. A couple more piercings over here, but no redness or irritation. Palpate. Any issues there? Any pain?
No.
Any pain here?
No.
Okay. Do you notice any difficulty with being able to hear things on one side or the other?
No.
Okay, excellent. I'm going to take a look at your nose now. It's symmetrical. I'm going to test patency, so I want you to breathe in. Very good. Now on the other side. All right. Now I'm going to take a look inside your mouth. Could you please open up wide? Very good. There's no obvious lesions, no tooth decay. All teeth seem to be present, and I don't see any chipped teeth. She does have a permanent retainer on her lower side for the first 6 teeth, it looks like. Tonsils are not present. Could you please stick your tongue out and say ah? Uvula is symmetrical and vibrates with sound. Take a look at your neck now. Upon first inspection, I don't see any jugular venous distension on either side. I'm now going to feel, and I don't feel anything out of the ordinary. Now I would like you to kind of move your head from side to side. I'm just testing the range of motion of your neck. Very good. Now I'll go forward and back. And then start with a chin tuck and just rotate back and forth. Very good. Now I'm going to feel your carotid pulses. Okay. pulses are palpable. I'm going to take a look at your lymph nodes now. I'm going to start up here in front of your ear. I'm going to go to the back side of your ear. I'm going to run down the posterior cervical chain. And then the anterior cervical chain. Underneath the jaw. Okay, I'm not palpating any enlarged lymph nodes. I'm going to take a look at your back now. So upon first inspection of the patient's back, her back is symmetrical, her shoulders are resting at a similar level. I'm going to have you take in a nice deep breath. Very good. Chest expansion is symmetrical on both sides. Now I'm going to feel on your back here. I'm going to kind of put a little pressure with my palm, and I just want you to, every time I move my hand, I just want you to say 99. Okay, go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, fremitus is within normal limits. I'm now going to percuss along there. You don't have to say anything this time. Okay, so now I'm going to do a CVA test near your kidneys here, and I just want you to let me know if there's any pain. I'm going to give you a nice little pat here on your back.
Okay. Nope. Nope.
Very good. Okay, now I'm going to listen to the lung sounds from the posterior side. Just breathe normally for me. Upon auscultation, I didn't hear anything abnormal, no rhonchi, coarse lung sounds, wheezing, nothing out of the ordinary. I'm now going to move back to the front side. Upon first inspection of the chest, it appears to be symmetrical. There's no obvious deformities. I am going to listen to your heart and your lungs on the front side now. So no abnormal heart sounds, murmurs. S1 and S2 sounds were audible. Lung sounds from the front were clear, equally on both sides. I'm now going to try to feel your apical pulse here, so I'm going to kind of come under your breast a little bit. Apical pulse is palpable and regular. I'm now going to take a look at your extremities. So I'm going to start with your hands and your arms. There's no noticeable edema. Hands look equal in color. There's no uneven hair distribution on the skin. Capillary refill on the right hand is appropriate, less than 3 seconds. I'm going to feel your radial pulse. Radial pulse is a +2. Brachial pulse is also palpable. I'm going to take a look at your left side. No obvious edema. Hands are appropriately colored. Capillary refill is appropriate, less than 3 seconds. I'm going to feel your radial pulse. And a brachial pulse. And I just want you to go ahead and give my hands a nice tight squeeze. Squeeze as you can. As hard as you can. Very good. Now I would like you to raise your arms up and now come in front and now go up and then back down. Shoulders have an appropriate range of motion. I would now like you to lay down on your back. I'm going to take a look at your belly. So upon first inspection, the abdomen is flat. There's no obvious deformities. I'm going to take a listen first. Bowel sounds are audible and normal active. Now I'm going to do a little percussion on your belly. And I'm going to do some light palpation first. I'm going to go a little bit deeper with my palpation here. Aortic pulse is palpable. On palpation, there's no noticeable abnormalities. I'm now going to take a look at your legs. Both legs look straight and even. I'm going to roll up the pants a little bit and take a look. There's no noticeable edema on either side. I'm going to take your socks off so I can take a look at your feet. Upon first inspection, feet are equal in color with the rest of the body. There is no noticeable edema. And feel your pulses. Pedal pulses are present. Post-tib pulses present. And they're equal on both sides. Capillary refill on the right side is appropriate, less than 3 seconds. On the left side is appropriate, less than 3 seconds. I'm going to move up the leg a little bit and feel the popliteal pulse. Popliteal pulse is present but faint on the right side. And equally as such on the left side. Can I just have you, actually I'm going to have you just relax. I'm going to lift your leg up here. I'm just going to test your range of motion. I'm going to abduct and adduct. Hip flexion was normal. And back down. And do the same on the right side. Hip flexion and knee flexion are normal. Abduction and adduction are also normal on both sides. Okay, I'm going to have you sit back up for me now. Now I want you to close your eyes, and I'm going to touch you with a cotton ball in different parts of your body, and I just want you to let me know where you feel it.
On my knee, my right knee, my right arm, my left arm, my left knee, my left hand, my right hand.
Okay, sensation is equal and bilateral. So now I am going to test your coordination a little bit. So I want you to just stick your hands out in front of you, and I just want you to pronate and supinate them as fast as you can. Fast as you can. Very good. So now I'm going to test your reflexes. I'm going to first, I don't have a hammer. I'm just going to hold your, actually I want you to rest your arm here, and I'm just going to tap your bicep. And do the same on the other side. Go ahead and just hold your arm steady. Okay, reflexes are normal in the hands. I'm now going to test your patellar reflexes. Maybe we can use the old iPhone. Patellar reflexes are normal. I'm now going to test your Achilles reflex back here. I'm just looking for the foot to flex a little bit. Patellar reflexes are normal, and then I'm just going to check the soles of your feet. I'm going to kind of start at your heel and go in a J shape. Good. And there is no Babinski reflex noted. Reflex was normal. The last thing I'm going to have you do is I just want you to stand up and come over here. And then I just want you to take a couple of steps this way. I'm just assessing your gait. Now on your way back, I want you to do a toe to heel walk. Toe to heel walk was successful, very good. At this point in time, step over this way a little bit. I want you to hold your arms out at your sides, lift up one leg, and close your eyes. Very good. Balance is normal. And the last thing I'm going to do is I'm going to check the range of motion of your spine. So I just want you to bend at the hips and kind of bend over as much as you can. Very good. Now stand straight up and I want you to go side to side. Very good. You can take a seat again. We are all done with the head to toe assessment. I thank you for coming in today and I hope you have a great day.
Thank you.